is Susan Chirasimfupa. I'm the community coordinator with Cervical Cancer Prevention Program. I'm HIV positive. I joined CIDRZ in 2000. I joined as a cleaner. I used to make tea, I used to clean the offices, I used to do all the clinic work during that time. My health wasn't all that good. So I decided to go for an HIV test because I wasn't well. I was losing weight. I was just like, wasn't me. So I decided to go for an HIV test, and my results came out positive. I was shocked, and I was in denial too, because I said I was one of the girls that didn't have so many boyfriends before I got married. I tested positive in 2004. There was so much stigma back then about HIV, and I was afraid what people would think of me if I test HIV positive. I was also worried if I test positive and if I die. There is no one who is going to take good care of my children. I was lucky. I joined a CIDRZ support group where I found all these leaders who were open about their HIV. All the members of the support groups were also HIV positive. So I thought to myself to say, I'm not alone. We are many of us with this disease. So I got so much encouragement from the members of the support group. We were encouraged to talk openly about our HIV status. I also received a lot of counseling so that I could accept my HIV status. I was also so passionate about my HIV status because I wanted to teach the world. Now that I'm HIV positive, I'm supposed to let the world know about my HIV status so that I could save somebody's life if they're HIV positive. And I also encourage everyone to go for an HIV test. So from there, I got a scholarship award from CIDRZ. So I did social work with the University of Zambia.
I first joined CIDRZ in 2013, and I met Susan at that time. I find Susan an inspiration because she was able to tackle both HIV and TB at a time when both diseases were quite prevalent and a lot of stigma and discrimination associated with those diseases. We have been an active partner to the government of Zambia in many areas. With the support of many partners as well as grants to our organization, we have been able to support the government's effort in implementing proven interventions by providing technical assistance, training to healthcare workers and community workers, as well as other logistics such as medical supplies and rehabilitation of infrastructure. We're a Zambian organization that is led by Zambians like me. We work closely with the government of Zambia to improve the quality of health of Zambians.
Mama yo yo yo, CIDRZ. CIDRZ Wusu, CIDRZ Wusu ma, CIDRZ Wusu ma, mama yo yo yo, CIDRZ Wusu, mama yo yo, CIDRZ Wusu ma, mama yo yo, CIDRZ Wusu ma, mama yo, CIDRZ Wusu, CIDRZ Wusu ma, CIDRZ Wusu ma, mama yo, CIDRZ Wusu, mama yo, CIDRZ Wusu ma. Echo ine sakwela basheri basuma, echo ine sokwela basheri basu, ati basheri basuma, basheri basuma, mama yo, basheri basu, mama yo, basheri basuma, mama yo, basheri basuma, mama yo, basheri basu, basheri basuma, basheri basuma, mama yo.
I decided to join cervical cancer prevention program. I thought I've done a lot about HIV. People were now open about their HIV status. We formed support groups in all the ART centers of Lusaka. I moved from being an ART community outreach coordinator into cervical cancer community outreach coordinator. I'm very adherent to my drugs. So all the time I take my drugs in the morning and in the evenings. My kids always try to remind me about when time comes for me to take my drugs. If they don't see me taking any drugs, I'm seated in the living room, carried away with the TV, they always bring a glass of water and my medication, because I also taught them that I'm HIV positive. They know about my HIV status, and they always try to remind me. I love my job. I like educating people on health issues. I'm passionate about what I do. When I do something, I just don't do it for the sake of money. I do it for the sake of saving somebody's life. I'm happy that CIDRZ has given me this opportunity of me going out in the community and teaching people about HIV, about cervical cancer, and the support that CIDRZ has given me. By my work with CIDRZ, I know that I'm really making things better for all Zambians.
CIDRZ is incredibly effective at saving lives through smart and innovative programs that we take to scale, through locally and globally relevant research, and through training that builds true capacity. Susan's path has been touched by all three legs of this mission. Just imagine the difference that she and many others like her within CIDRZ make every day as they reach out effectively to other members of their communities who are in need of care and treatment services, prevention, or who may be at home with severe illness. As a nascent local organization, CIDRZ is at a critical juncture. Although the organization has a tremendous track record of success, we must strengthen our foundation and build financial independence and sustainability, even while we continue to deliver on our mission. With your help and the help of a network of committed individuals and other donors, CIDRZ can become a permanent resource to the people and the government of the Republic of Zambia. Always innovating, always on the cutting edge, and building impactful professional pathways in Zambia for the next generation of health leaders on the African continent. Donations we receive will be used to support strategic opportunities across the organization. With any amount of funding, we can make real and measurable differences in the health of Zambians across the country and improve the long-term sustainability of our thriving organization. Because CIDRZ is a truly local organization, I have more faith than ever that the gains we make today will be sustained by the talented Zambians I work with every day in our organization. And every time I hear a story like Susan's, I know more than ever that we're on the right path towards making a difference.
Each one of these samples comes from a source, and that source is a patient who is out there. Every sample represents a life.